Okay. Well, thank you all. It's very nice to meet you. My name is Jessica Jagir, and to give you some background, I've been in healthcare for 25 years, servicing individuals with cognitive, physical, and mental health disabilities. Throughout my career, I've done home care, adult day health, and in the whole gamut of healthcare, really in the field trying to help people. I started at Medminder about 5 years ago, and I really love the service we provide to not only members that we serve, but to their caregivers, providers, to really help empower them to be more independent, to have support remotely through our systems. And I've really seen a real change in people's lives, particularly the patients being able to remain at home and really support the services and staff involved with their care. Just to give you some background on Medminder, it was invented 17 years ago by our founder at MIT. And how it was designed was through home care nurses that wanted to really instill independence with their members at home and have a very easy to use, seamless assisted technology. The device is FDA approved, so it is licensed through the state, and it has all the functionality approved through the FDA. So that makes people feel a little more safe. We are able to work with any states. We do have a pharmacy involved, but the device can be shipped out anywhere. I really love a quick overview, Naomi, of what you guys do, the population you serve, and how your services work maybe differently than other AT services in states.
We are the Assistive Technology Act for New Jersey, so we serve the whole state of New Jersey with demos. We have a technology lending center and reuse center. And we just get resources out there to the whole of New Jersey. I'd be more than happy to go over this with you in more detail. But since we only have a half hour, I want you to really dive into the
Sure.
Medminder. Thank
Absolutely.
you.
Yeah, I appreciate it. I just want to make sure, I'm finding out about you guys too. So, we'll both kind of collaborate to see the best appropriate members for our services. Okay, so I'm going to share my screen with you. Give me 1 second. Screen share. Okay. Okay. Can you see my slides?
Yes.
Perfect. I'm going to go here. So as I mentioned, our assisted technology is comprehensive with our hardware, which is our Medminder Class 2 device. And everything around the device is secured and stored on a secured cloud for privacy. Our data really can display medication adherence to find out trigger behaviors to enable members to really take their medication on time with reminders. I'm going to get into the exact functionality of the device. So the device weighs about 7 pounds. It is portable. It has 28 compartments. So if a member takes 1 medication a day, you could see this as a month supply. Members can take 2 medications a day, which is commonly configured with an AM and PM dose. And if they take medications 3 or 4 times a day, for example, it could be, an AM, afternoon, dinner time, and then a bedtime dose. It can just support any medication regimen. We also have the capability to enable individual compartments for PRNs. So if someone in the community was filling the Medminder device, they would go in and fill it either once a month, every 2 weeks, or once a week. The device comes with a Verizon SIM card, so it doesn't need Wi-Fi, but it can connect to Wi-Fi. So in the event of a power outage, it has a 12-hour battery life, should be plugged in at all times, but nothing in the device gets disrupted because it is like a cell phone. It has that cellular data and it's backed up to our cloud. I'm going to go through the progression of alerts. So again, this is really supportive to caregivers as well as members. Specifically, if we have young adults and even older adults that really feel that someone's trying to control their medication regime, this device is something that they have control over. When it is time for the member to take their medication, our solution will register the device and take into account what times the member should take their medication. So let's say, for example, one of your members takes their medications at 8 a.m. The progression goes as such. At 8 o'clock, the device will start to flash at the appropriate time frame in the only appropriate compartment will start to flash. This is a very good alert for members that are hearing impaired because they can see the flashing and the screen will display take your medications. If patients have or members in the community have some vision impairment, they can see the flashing peripherally. So if the member doesn't adhere to that 8 o'clock flashing, the flashing does continue throughout 2 hours of alerts. By 8:30, sorry, it's half an hour progression alerts. By 8:30, the device can either provide a customizable greeting that we can type in or whoever has access to the device can type in, and it can say, "Good morning, Jessica. It's time to take your medication and check your blood sugar. Good morning, Mom. Time to get up, take your medication. I love you and have a good day." So you can type in any messaging, any language, and then to take it a step further, someone can go on our Medminder Connect application and voice record their own voice, their own language, their own messaging. You can provide a one special time message, happy birthday, take your meds, right? So it has a great function to alert members to do what they need to do for the day. We have members that have some mental health and a voice command could be alarming. So at that 8:30 time frame, it can just beep and not talk. And so the beeping has, 3 volume alerts. It can be very loud and the progression will continue for the 2 hours until the medication is taken. So at 9 o'clock, the progression is to send an automated call to the member if they have a cell phone or a landline and say, again, it's time to take your medication. If the member does not adhere to that 9 o'clock phone call from the pharmacy, by 9:30, the system can alert a caregiver provider, up to 20 people involved in the member's care, alerting them that member has not taken their medication and something could be going on. We find that caregivers, have really saved members that, had fallen in the middle of the night and they were alerted someone didn't take their meds. So when they called, they didn't get an answer. They went to the member's home and found member on the floor. So this device has absolutely been a lifesaver for many patients that I've seen in my 5 years. And again, supporting their caregivers from afar. So once the member does take their medication, as I mentioned, it's designed for people that have some dexterity issues, cognitive impairment. It's very simple to open the little compartment. They take out the cup, take their meds. All alerts will stop. Every interaction will then be recorded and stored on our cloud for anyone to access that is involved with their care. One really important feature to mention here is that the device has a locking mechanism. And what that entails is that the only compartment that can be accessed is the one that is due at the time and day of their dose. all other compartments will remain locked. And that's an amazing feature for patients that have cognitive impairment or any substance seeking issues as well. Any population can fall into chronic pain and complex care needs, and they might have an issue and they try to get into the device prior to when they're supposed to. The device also has a locking component at the bottom of the device, so you cannot open the parcel without a key, and then whoever's using the device would have access to open the parcel. Now, as I mentioned earlier, you have access to an individual compartment if the member missed the dose, if the member needed to take a med early. Someone involved with the member's care can access an individual compartment. I'm going to stop here and ask if there's any questions. Now, I saw something in the chat. I just want to make sure, please. Okay, wait. Thank you. Okay. Just want to make sure if anyone has a question. I'm giving some time. Okay. We're going to, oh, sorry. We're going to keep moving on. Thank you. So the Medminder has a Verizon SIM card, so it works like a cellular phone in some senses. It has video capabilities. I'm sorry, so camera. So you can actually talk to a member through the phone, through the device. You can see if they're actually taking their meds. That's just a feature and a function that we do provide. So that's something we do. It has Bluetooth capabilities, and it has visible weather forecasts on the screen. Plus, you can upload family photos, making the experience a wonderful one. I also like to mention members with supportive living and in different housing, smart livings, have really seen a reduction in medication errors. Like I mentioned earlier, reduce in hospitalization and healthcare costs have reduced. Let alone in Massachusetts, there are 19,000 job openings for nursing staff. So our device really helps with that issue. Let's see here. We're going to go to the next slide, and I'm going to show you a quick video. Let me know if you can hear it. I don't know if there's a special. Can you hear it?
No.
No. Okay. Let's see here. I might have to. Do you know if there's a? I'm going to stop the share for a minute. Oh wait, let's see what this is. Share sound. Okay, let me know if you can hear it now.
With Medminder Pharmacy, you can.
Yes, I can hear it now.
We sort and organize all of the medications into disposable trays delivered right to their door. And we'll also provide the Medminder Smart Pill Dispenser.
Oops, sorry.
They just insert the provided pre-sorted tray into the pill dispenser and can safely enjoy their independence. And for your peace of mind, you can manage the pill dispenser remotely. Enable custom alerts that will remind them when to take their meds and notify you if they miss a dose. And for additional safety, you can opt for locked compartments to ensure the right dose is taken at the right time. And if needed, an emergency call center service is available with the click of a button. And the Medminder Pill Dispenser offers daily weather forecast, the ability to upload family pictures, and record personalized greetings remotely. And our pharmacist will even take care of your refills. Only Medminder Pharmacy provides such a comprehensive medication.
So that is the Medminder and how it actually all comes together in the experience. So any questions here before I move forward?
Actually, I do have a question.
Yes, please.
So using your pharmacy to send the pills, do you have to do that, or can you get the device without the pharmacy?
Absolutely. So we actually have two lines of business, just the assisted technology, and then we have our pharmacy. And in the state of New Jersey, we are Medicare and commercially licensed. We do not have Medicaid in New Jersey at this time. So, if one of your members has Medicare, Medicaid, they might qualify for the pharmacy, but it is not necessary in any means. We do partner with other pharmacies that can fill our trays if necessary, or an individual can fill someone's tray. So no, it is completely two separate business lines.
One of the challenges that we've discovered trying to use some of these pre-pour pharmacy services is that clients that have certain medications, particularly Eliquis, seems to be a challenging one. You can't buy them in the 90-day supply, which affords a certain savings of money, but they will only fill them in 30-day increments. And because of that, it ends up costing considerably more. So a lot of the clients are rejecting the option just based on cost. Is that
Yeah.
something that your pharmacy has like a workaround, or?
I could look into it. Let me ask. So, I mean, and transparently speaking, if someone's, filling their individual medications, they can fill it for the month, for the week, or the 2 weeks. So that wouldn't be an issue even if they got them in bottles, right? And then had to fill it into the device. But I will ask Eliquis, and I can let Naomi know. Cost 90-day versus 30. We find it in our experience to have the 30 days is better because anything can change. It's just safer in terms of errors, but that's a good question. You're on mute. You're on mute.
I was just saying, do you have some accommodation? Like some services do have a representative, for example, that will come out and break down the box if need be, if the prepackaged were to change, or would that be up to another caregiver to take care of?
That would be up to another caregiver or
Okay.
supportive living assistant, right? Yes.
Sure. Okay, thank you.
Great questions. Thank you so much, Christina. Anyone else have any questions? Okay. So this is what your organization or families or caregivers or providers would receive. We have an entire Medminder Connect platform that supports every interaction around the device. So again, if you have, a caregiver that has to go to an appointment, you can check on your mobile app, did so-and-so take their meds? You can see their history. You can see if there's a triggered behavior associated with a certain time frame. And that's really what makes the locking feature really crucial, because you might see after a couple weeks one of their medications should be taking at night and not in the morning. So it really gives you insight to what's happening in the home, the chemistry with the member and their medications. This is our mobile app, and it can connect with Verizon and the other mobile apps. So again, we have a platform that you can go onto on our web, or you can do it specifically from a phone. Change medication times, change, what medication doses in the dispenser. This actually connects right to our Medminder dispenser. Caregivers and providers, multiple people can get access to this one individual's history. But again, it's all HIPAA compliant. And, just our monthly subscription and our software. This is all the services I had mentioned previously. This is a report from an actual live account. I took out their names for HIPAA purposes, but basically this report is something that comes with our service if it's requested. It shows the last time someone's been online. So you can say, oh, geez, I couldn't get in touch with so-and-so, but they were online. So that's great. You can click on this and it goes right to their device setup. And then it shows you their adherence scores. So, we work with different health plans, and there's a list here, and then it shows you, the adherence. Specifically, if you work with supported living or any kind of supportive environment or case management, and one person has 20 clients they work with, another person has 25, the admin would get to see all the members in your organization, but you could actually set up subgroups so that your employees can only see the members that they are covering or following. So it's really unique, the platform and what it can do to individualize reporting. And then we have partners with many AT companies in Massachusetts. We work with Wind Wreath, May Institute, Easter Seals, UCP. So there's a multitude, LAD in Ohio, a multitude of members that have access to this service. With some of these vendors, we do sign an agreement that, something that your service, your organization can offer in terms of other, dispensers, and find out which is the best for your member, because we know it's patient choice. But when an organization such as yours does enter an agreement with us, pricing and cost can actually be reduced as well. And that is it. So I'm going to stop sharing here and see if you guys have any more questions. Everyone, can you share on the time frame of how long coverage on the Medminder under Medicaid is available? So the device is funded through either different organizations through grants or funding, or assisted technology waivers. And so different partners with us can, include our services into their medication adherence programs. And, they could lease, 20 to 50 devices, and either the grant through the state for, DMH, assisted technology, DDS, has funding for this. So that's how we're reimbursed. We are not under a New Jersey waiver at this time for our pharmacy, because we just don't have one, right? But it is supported by that AT waiver and funding throughout the states. So we partner with Mass, we partner with some in New York, Wisconsin, Ohio is our biggest, and then Vermont. AT individuals.
So, quick question.
Mm-hmm.
So I actually work in adult assistive care.
Okay.
And so we are in people's homes providing home health aides.
Mm-hmm.
And I'm forever trying to find a better way to make sure that my clients are able to maintain their medication regime while maintaining their independence at home. It's a huge challenge for clients with dementia.
Yep.
And something like your equipment seems like that would be phenomenal. But a lot of similar products seem very unaffordable for our clients. So I'm wondering if there is some sort of program that would cover it based on the diagnosis of the dementia.
So that is something that you guys would have to create a budget for within the state funding. I don't know those things, especially in New Jersey, but I know like Vermont would certainly, they're creating a budget because there's such a need for this product. The fact that you can do camera, you could, everything is detected. There's a sensory board under the machine, so everything is shown real time. But if someone's actually taking their meds, people want to be able to see that. So that's a function and a feature. The locking system is extremely unique because you can't abuse it. You can't open it at the wrong time, but you can access a med if it's emergent, right? So hospital homes are trying to see how we can integrate it. MAB programs, we are just blowing up. I met with the Wisconsin Home Health Mental Health Organization yesterday. And yeah, so if there's more devices bought or purchased, the price absolutely goes down. And like I said, different organizations are incorporating the Medminder into their medication adherence enrichment programs. So like if your organization says, let's buy 30 of them, and you're either reimbursed by the member or the waiver or whatever funding they have in their system, you can make some profit, but also you're reducing hospital care. If you have a nurse that's out sick, they can remotely do it from their home and monitor the patient. They don't have to go in 6 to 8 times a day to remind the patient to take their meds. If the patient doesn't take their meds, they're alerted. So you are saving so much money. If someone's supposed to get a med pass, organizations are paid $30 for a med pass. If you don't have a nurse, you'll get the $30 in your pocket, but also have someone monitoring the member.
Yeah.
The other thing I really like to inform everyone is, being in healthcare for 25 years myself, in the industry, how important it is to have someone there for you and your members, customer service. We have a high touch customer service experience program that each organization gets an individual support person, so they can call up, they can get a phone line, an email, and they can get support at their fingertips. And then we do monthly check-ins. How's things going? Do you see anything different? Is there something you like? That to me is why I do this. I want to make sure no matter what, our partners are supported.
Okay. All right,
So
thank you.
someone had a question. I'd love to set up an appointment with you. Work for Delaware State. Yep. Okay. So Delaware State. Let me write that down. State. Perfect. Yeah, I mean, there's I got on this call yesterday with Wisconsin. They're like, we have a ton of funding for the mental health for, the hard thing is we used to be primarily with seniors with Alzheimer's dementia. There's not a lot of funding for that. You have to have some other disability, and that's so unfair. And again, that was my near and dear to my heart. I used to run support groups for families and take care of members, in groups. So it's MLAQ. Perfect. And I can put my information in here as well. I'm very responsive. Like I said, I have 2 kids and I work from home, which I'm grateful for, right? But it allows me to be available for everyone. And I love what I do. I love helping people. And if I can make a difference in someone's life, and I always think about the caregivers. That's what I think about as well. So that's that. This is my cell as well, always available. Okay. Any other questions? No. So Christina, did you want to connect further, or what is your thought process on that?
Well, I think the scale that you're talking about is not what I particularly was looking for. I'm just a clinical manager.
Mhm.
So I have my caseload, but it's not sufficient that I would be able to say, let's purchase 20 units and figure out the cost management later. I was thinking for like individual specific clients. But I do think it is a program I'd like to get more information about and take that to the appropriate people within our organization and see if there is an option for us to, as you were suggesting, perhaps, purchase in bulk and see if there isn't some sort of grant or other funding that would be available to help pay for it.
Right, and what we've done, and what we've done with other organizations, we sign an agreement like, there's going to be 20 or 30 to onboard, and you don't have to get 20 or 30 right away. People start out with 5, 10, and then they progress as soon as they kind of implement the system, and we train people. There's so much, that we're not going to just throw it in your lap. We want to make sure it is successfully onboarded. So if you talk to other case managers, there might be opportunities as well there.
Yes, I definitely will try to explore that option. I can actually send you my email address, and then
Perfect.
if you can send me some additional information, that would be great.
Perfect.
Thank you.
Anybody have anything else?
This was wonderful, Jessica. Thank you so much. Lots of great information. Any last questions, anyone? This is your last chance. Otherwise, we will be calling it a wrap. And thank you everyone for joining.
Thank you so much. And I really appreciate you, Naomi, for setting this all up. It was wonderful.
Thank you.